express. Talking families, should I care, and public theology, exploring expressions of the Christian faith. Are These are the part of the initiative in group writing on issues of contemporary consent. So uh, uh, I think there is no better person fit to talk on this particular topic than Dr. Jamila. So I hand over the session to Dr. Jamila. Let's all be attentive and kindly mute yourselves if it is not needed to talk. Yeah, and Q&A will follow at the end. Thank you. Over to you, Dr. Jamila.
Yes, thank you so much. Okay, so burnout. I'm not sure what sparked the interest in this, but after the COVID pandemic, burnout became a big issue, particularly in my field of work, which is the medical field. A lot of doctors and nurses were going through a lot of this, literally this burnout syndrome, because they were being asked to work long hours with, well, there was some recognition, but nobody could actually fathom the amount of stress that many of the ICU doctors and all were going through. And it was at considerable risk because many of them were getting sick. Nurses and doctors died, many of them during the pandemic. And this was not with any increased remuneration or anything like that. It was just expected that they have to do it, So, yeah, so there was a lot of burnout of medical professionals in that field. So yes, this is an important topic, not only to the medical field, but also to others, because it's not true that, earlier we used to feel that the main areas where people experience uh, burnout is in the medical field. In fact, psychiatry, my field, was one of the most it was supposed to be very prevalent among psychiatrists, burnout. But now we know that it's not just among mental health professionals and healthcare professionals, but it's also a real problem among people who provide services at a humanitarian level, particularly social workers, those who are working with, flood relief victims or rape victims, those who are working with any kind of trauma situation. Education, the field of education is also very prone to burnout, all right? And now we know increasingly that it's there in many other fields as well. Pastors and those involved with mission setting work, pioneer work, HR, all these areas can be very prone to burnout. It's probably because these are areas where you require a very long, drawn out personal contact with people in need, and there is an often strong emotional content to it on both sides. So this kind of setting can be can cause a lot of burnout. This sort of burnout, there are other types as well, which we will come to. This type of burnout has also been called compassion fatigue or a secondary kind of traumatic stress. Okay, it's not, you are not the one experiencing the stress, but each time, I mean, I'm a psychiatrist and I have been trained to be objective about people's problems. You're able to stand at a distance, you're able to separate yourself from the problem to a probably better extent than others. But even then, I was just confiding to my husband today that there are some patients, when they call itself, my heart sinks, because I know that this is going to be a long and difficult conversation. And it's sometimes you feel, you yourself feel this patient is not seeing the light at the end of the tunnel, and I have to bring that light for her. Where do I bring it from? So sometimes it can be a very secondary traumatic stress which you go through, or vicarious traumatization. Okay, so these are all terms which have been used in place of burnout, particularly in this human services kind of setting. Okay, going ahead, let's look at what the opposite, in a sense, of burnout would be. This is not quite the opposite, but perhaps it will give us some idea so that we can compare. All right. a sense of engagement in your work, a sense of commitment and involvement. Okay. So high energy and enthusiasm for your work, a strong sense of involvement, and a sense of efficacy, feeling that you are competent, feeling that you are making a difference, feeling that you're on top of the problem, you're able to contribute, you're doing it well. So these three things, when they are there, then it is a state which is opposite in a sense to burnout. So this is what we might call engagement, okay, active engagement with the job. And this is, of course, what we would all ideally want. This is how people often go into jobs, with high energy and enthusiasm, with a strong sense of involvement and a sense of making a difference and a sense of competence. Okay, that's how everybody goes in. But over time, as this goes on, sometimes what sets in after a prolonged kind of issue where there's these interpersonal issues are there at work, you can have this prolonged stressful situation leading to this psychological syndrome, which we call burnout. All right. Now, in this burnout syndrome, there are three things which are very commonly seen, and they are the things that we need to watch out for. There is this overwhelming sense of exhaustion or tiredness. There is a feeling of cynicism and detachment from the job, and that there can be a sense of ineffectiveness and lack of accomplishment. So as you see, that's opposite to the engagement picture. No? The engagement picture was of enthusiasm and high energy. So here you have the opposite, an overwhelming sense of exhaustion instead. The first setting, the engaged person has a sense of commitment to the job, right? He has a sense of involvement in the organization or the mission or the task or whatever it is. But the person who's burnt out has a sense of detachment from the job and a feeling of cynicism that, okay, this is not okay, where's this going? No, yeah. What's the point of this? That sort of cynical attitude, when it sets in, it's a strong indicator that the person is burnt out. And as I said, the engaged person has a sense of efficacy, that I'm able to do this task and it's an important task and I'm accomplishing something. But instead, the burnt out person feels a sense of ineffectiveness, a sense that I'm not accomplishing anything, and what is the purpose of this job, and it's a pointless job, and that sort of feeling. Okay, now there are different theories of how these three things interact and which even comes first. So I won't go into all the theories and all that because it's not really that relevant. Let's look first at the situations where you can have burnout, right? Now, I talked about the healthcare segment, the psychiatry segment, for instance, or the humanitarian segment, teaching, education. These are all fields where you can have burnout. But you can have burnout even in a common office setting. And I've deliberately picked three pictures, which are all of a very office computer-based job sort of thing. And I want you to see the difference in these, okay? All of these three can lead to burnout. Suppose you have that first picture on the left, where you can see it's a scene of very busy activity, right? Everybody's on their laptop, somebody's talking, somebody's doing something. It looks like a very busy scene where there's heavy activity, a lot of things to be accomplished. There's a deadline perhaps, and everybody has to work together, and there's a lot of sense of synergy, and there's a lot of activity going on, right? Often this kind of thing can happen if you have, say, a contract job where you're given a job for 6 months or a year, and you have to perform and you have to live up to certain expectations within that short period. So people on a contract job can have this commitment to finish. So there'll be a lot of heavy input during the time they have a job. They may have a break after that, but these heavy activity kind of situations shift jobs, for instance. Sometimes you're working from say 9 to 9 or 3 to 11 or whatever it is. But during that time, there will be a lot of heavy activity. So when this kind of prolonged heavy activity situation goes on for a long time, the workload can be so incessant and tiring and exhausting that it can lead to burnout. Then there's the opposite, which is a very under challenging job. It can be a very boring or routine kind of task which you are asked to do. Maybe just enter some data. It's always the same. Maybe you just have to change a few figures here and there. It's very mechanical, maybe just some clerical kind of input. And there's nothing much to tax your brain. There's nothing to think about. There's nothing to question. And there's nothing interesting coming of it. Okay. You don't see any fruit in it. So this kind of situation, that second guy sitting there, you can see he's bored. It's boring and under challenging. And therefore, it can lead to a sense of, oh, what am I doing here? What's the point of this? This is a boring job. So this kind of thing can also lead to a sense of burnout. And then finally, I'm not sure if this picture brings it out, but I hope it does, that this is a situation where the worker may be putting in a lot of effort. Okay, it may be something which is difficult, and maybe the parameters of the job are given to you. Somebody else is dictating how it should be done, and you have to sort of follow the protocol or the routine or whatever it is, but you have no control over it. And you may be working very hard to try and accomplish what is meant to be done, but it may be very difficult to do. And the person may end up being very worn out, and they may not be able to control either the process or the, how to do it, or how many hours they are putting in order to finish it. So this kind of situation, the girl here, can also lead to burnout. And I hope that as I'm speaking, many of you may be able to identify these kind of settings in your own job places, and maybe we can talk about it later. Okay, so then let's look at those three things. The sense of exhaustion first. Usually this is thought to come in first because of the incessant workload, particularly if the company has not done anything to reduce the workload, or if you personally have done nothing significant or effective enough to reduce the workload. So if there is a very incessant task which is continuing all the time, then it may lead to this sense of exhaustion. Now, the exhaustion is not necessarily physical, okay? It may be partly physical, but greater than the physical exhaustion is the mental exhaustion which sets in. So there is an emotional exhaustion here. The person is tired. They don't want to put in the effort. They are unable to put in the mental effort, the emotional effort to getting the task done. So this sense of overwhelming exhaustion is very much part of burnout. You may feel tired to go to work. You may feel you get up in the morning and you're not enthused to go to work because you're sure that there's so much to do and I'm not sure how I'm going to get it done and I'm not sure what to put as priority. So there's a lack of enthusiasm, and there's a sometimes absenteeism, frequent taking breaks, coming late, coming to office, and then perhaps, just whiling away your time because you are not able to get into the task because there's no enthusiasm to do so. Okay. Then there is the sense of cynicism and detachment, which can be very, what to say, it can be the crux of the matter here sometimes. That because of this emotional exhaustion, you have developed very negative attitudes to your job. So the attitude may be one of unconcern, okay, even if it is a sick person coming in. All of us probably have experienced this in hospitals, right? You've come in, but instead of concern being shown, everybody is a little bored. What's your problem? All right, fine, go there, wait, fill up this form. So there may be a sense of unconcern. There may be a sense of indifference, which is communicated to the client. You may not be very responsive to their need or whatever. Okay, no, I'm using the example of hospitals often because I'm a medical person, but you can probably put this into any setting where the response of the worker is not appropriate to the need. Rather than a sense of enthusiasm and engaging and serving, it becomes an attitude of unconcern or indifference. This can happen. Sometimes there can be a lot of irritability. There can be a dislike even of the patient coming in or the person coming to you for help in the government office. We see this often in government offices, don't we? It's almost as if the person coming in for help is a pain in the neck, that why have you come to bother me? So the sense of irritability or dislike of the client may be communicated very strongly because the person is cynical about their job. They don't see it as important. They are detached. They are just filling in the time. Okay, so there is this loss of idealism, the loss of feeling that this job is important. That can be a very sad thing, right? To see and to go through, that you have no idealistic connection to your job. You're detached from it. You withdraw from it in many senses. Okay, coupled with this, maybe because of the workload, because it was too much, then you got tired, and you're now unable to do it. Now you're cynical, you're not sure what you're doing it for. So ultimately it leads to a sense of ineffectiveness. You may actually be not productive because you don't have the energy and the enthusiasm to do anything. You may be less capable than before, less productive than before. And then along with that, your morale also may sink. You may assess yourself very negatively. You may know that, look, I'm not doing this job well. And that may lead to doubting not just your performance, but also your ability. That, look, I'm not competent. I can't do this job. Maybe I should quit. Maybe I am not fit for this job. Maybe somebody else should take it up. Maybe I made a mistake. This was never where I should be. So that sense of doubting one's ability may set in. And you might just not be able to cope with the normal stresses and strains of the job, which you could have done earlier. But now, if 5 people are standing in a queue, it stresses you out, whereas earlier you may have been able to calmly handle 10 people in a queue. So that inability to cope with the stress, like if earlier, if the boss was sitting on your head a little bit, finish this job by 2 o'clock, you may have been able to calmly do it, or tell the boss that, okay, sir, give me an hour more, I'll finish it by 3. But this time you may be unable to take that, the boss putting that much pressure on you, just asking for the task to be done by 2, and you may sort of get frantic, or get procrastinate even more, or freeze, or just make mistakes, or whatever, an inability to cope with the normal stresses of the job. So these 3 things will be seen when the person is burnt out. Okay, now we've looked at the situations where you have burnout. We've looked at what happens. Now let's look at why. Why does all this happen? And as I said, there are many theories as to why it happens, and which comes first, and how it works, and how they work together. I'm not going to go into all that, but I'm just going to talk about these 6 areas in which there might be mismatches. Forget which comes first and all that. Let's just look at these 6 areas where, if there are problems in many of these areas, it's likely that you will cause burnout in the person who is with you. So the most important, the first at least, which we would always say, is this whole thing of workload and the hours of work. So if there is a lot of work, like for instance, during the time of COVID, right? There was a lot of work, and it was difficult work in the sense that it was a new virus, okay? And people were just learning about it, and they were learning how to handle it, and the studies were just being done on what medicines are to be used, and how they are to be used, and what is the pathology of the illness. So the workload involved in learning all this was very high, and at the same time the number of patients coming in critically ill was very high, right? And because of that, there was a whole lot of new things which had to be learned in those short hours. You had to learn how to handle the new ICUs which were being set up. You had to learn how to handle the personal protective equipment. You had to learn how to do a whole lot of things suddenly, okay, which were sort of new to many of the nursing and medical staff. So the workload increased, the work hours increased. And if you continue this for very long, it becomes very difficult to prevent burnout. So, of course, many hospitals and all managed this well, in the sense that I remember in our hospital, people were asked to work, I think, for 3 or 4 days, and then they would get 2 or 3 days off, or something like that, in the ICU. So it was a very sustainable and manageable thing, giving enough time to the staff in the ICU to rest. So of course, this came in only after some time. In the initial phase, there was there was no ability to be able to do that. People were just worked off their feet. But after some time, when people realized that no, this is not working, we have to give in hours of rest, then I think they had 4 days on and 2 days off, something like that. Okay, I'm not sure the exact details, but the point is, it has to be sustainable and manageable, giving adequate time for the person to rest and relax and have this work-life balance, right? You have to have time for your family. You have to have time for your own personal needs. You have to have time for administrative work and honing other skills, carrying out your routine activities at home. There has to be enough time for everything. So the workload and the hours are very crucial to maintaining a proper sense of balance in one's work. Now, control is very important. When a person feels that they have the ability to influence decisions regarding their work, then they feel better about the job. Whereas, as I told you earlier, in that situation where the girl had no control over what she was doing, she has no control over the protocols to be used. She has no control over, maybe the process or the procedure or anything. If you don't have control and it's just sort of topified on you, then it's very likely that you're going to find this very stressful and you're not able to cope with it. And after some time, it begins to tell. So giving professional autonomy, giving easy access to resources, giving the ability to control the decisions affecting your work and the work of your department, this will lead to less burnout. If doesn't happen and all these things are negated, then obviously the person goes into a state of burnout. Reward is also important, okay, because rewards give value to people, right? They tell people that we value you. They tell people that you are important and you are efficacious, you are competent. They tell people that you are doing a good job, right? So if there is insufficient or very arbitrary rewards, if it's not consistent, it can devalue people. It can help them, it can make them feel that, oh, this is, this is pointless, can make them cynical. So the reward does not need necessarily to be a financial reward. It could even be praise or a sense of encouragement or a sense of, a corporate celebration. These are all rewards for a job well done. So this has to happen regularly. Otherwise, people can have a sense of burnout. Community is important because unless there is a sense of support and a trust in your co-workers, then the whole work group or the work area becomes a place of conflict. And if the conflict is not resolved, then this can lead to a lot of burnout. And I'm sure you have all heard this, no? That the basic cause for the most common cause for people leaving a job is not financial or is not anything like that. It's usually the boss. If the boss is if the boss is kind, if the boss is supportive, if the boss is encouraging, gives space to learn, gives autonomy to the person, then almost always people are happy to stay on, even if the financial remuneration is not as great as outside. So the sense of community, the sense of belonging, the sense of support and trust with co-workers is very important to stave off the burnout. If it's not there, people burn out much faster when they feel alone and isolated, that no one is helping, I'm all alone doing this. Okay, fairness in an organization is very important, because if there is a lack of fairness, if somebody is praised and another person is not, if somebody is given opportunity and another person is not, if if I do the work but the credit goes to someone else, or if I do the work but my contribution is not recognized, but somebody else says the same thing and they are recognized, this sort of unfairness in an organization can lead to a lot of cynicism. It can lead to a sense of hostility and anger with the organization, and that tends to cause burnout. So a fair and just organization will lead to people not being burned out as much. Now, similarly, the values of the organization are important. Why did a person join a place in the first place? You might have joined because they are doing good work, they're serving the poor, or they have this good ethics, or they create this great product, okay, which they are proud of, which they manufacture in a very good way, or they do this job which is sort of praised world over. They are global leaders in this particular area. So whatever it is, the values of the organization and the individual should match. if the values of the organization and the individual don't match, then it can lead to burnout. Because if I have joined thinking that I will serve the poor in this hospital, and then if I find that the hospital suddenly doesn't want to serve the poor and they only want to serve the rich, and the poor are given short shift and they're not, then they're ignored, and they're only paying attention to people from abroad who come with a lot of money and want to do only some fancy some fancy operations or do fancy tests or very expensive stuff, then I might feel that, okay, what am I doing here? This place is not really worth it. I might as well leave. So if I stay on, I'm not staying on because I want to. I'm staying on because I want that money which I'm getting as my salary. That's all. So work is not something which I want to do, or it's not something ideal. It's just something that I have to do for my stomach, okay, for my salary. So that can lead to a sense of burnout because you're not really committed and your idealism is lost, and all the sort of thing which follows. So these 6 areas are important, and particularly if you are in a position of influence in your organization, please remember these 6 areas. Okay, the workload, the sense of control which employees need, the sense of fair rewards, a good community, and a organization that values. Okay, so what is the consequence of burnout? What happens to people when they burn out? As I said, because they are, their negative attitudes can come up, right? Because we said they are not really enthused about the job and they have the sense of cynicism and detachment. It can lead to a lot of negative reactions. As I said, sometimes you go to a government office and it's as if they are saying, why are you here? Why are you troubling me? You go and ask for your license and they'll say, it's shut, you come back tomorrow. Okay, we are shutting at 1 o'clock, so at 12:30 itself they want to shut the counter because they're going to shut at 1 o'clock for lunch, right? So this kind of negative reaction often happens because people don't have that sense of involvement and energy in their work. They have rather got burnt out. So negative reactions and aggression can be one sign of burnout. Lower productivity. If somebody is not really working very well or their work is shoddy, they're not really very keen about it. And I often think sometimes that people who do menial jobs like cleaning the streets and things like that, how many of them actually have a sense of pride in their work? Or how many of them are burnt out? They're just doing it because they have to do it because it's their job. They're not doing it because it's something they want to do or they are energetic about or enthusiastic about. So poor work, shoddy work, and lower productivity is often a sign of burnout on your job because you don't have that go anymore. Withdrawal from the job, okay, just kind of filling in hours, 8 to 5, sometimes not even filling it in, taking a lot of absenteeism, taking chutti whenever you can, coming late to the office, all these kind of things consistently. When this sort of thing happens always, we can think that there is a sense of burnout happening. Sometimes there is no commitment to the organization. Okay, the person is always looking for a job change, and uh, I think sometimes that many young people these days they get into this quickly, probably because of this. There is no sense of um, community, of fairness in the job. There's no sense of reward for a task well done, but they're just kind of doing the job because they want something from it. They want a salary or they want promotion or they want something, and once they get it, they are quite happy to go off because they have lost that enthusiasm for the job. There's no commitment to the organization left. So a rapid turnover because of this happens. Now, along with that, there is this conflict between people, and this leads to what we call burnout contagion. Okay, so it can spread because if you are negative and you are aggressive, not only with the clients, also with your colleagues, obviously the colleague themselves is going to feel that, hey, this workplace is horrible because my colleagues don't support me. This one's always snapping at me. So if there is aggression and negative attitude in one person, it can often spread, and so you can find that the whole system is burnt out. And I remember taking sessions once for a school which should have been different because it started off with a very committed set of teachers. But I remember thinking that I have never seen such disillusioned and cynical teachers as I met there. Because perhaps it was the contagion. Now, looking back, I think it may have been the contagion, because a few of them were so disillusioned and cynical that they felt that, oh, nothing is going to work. These children are all like this. Uh, this one is going to fail all the time. Nothing is going to change. So, this kind of attitude, when it is there in one, it can easily spread to the others. That, okay, our job is not really worth very much. We just have to teach something. The children don't actually learn anything. You are talking about critical thinking and all that. Where these children will get any critical thinking? So if you talk in this way, it's very easy for it to spread to others. No, so this can happen. It can ruin the whole organization in a sense. It also ruins each person, because if you are burnt out, it's interesting that it can lead to a lot of health consequences. And of course, it can happen both ways. I'll come to that. But a lot of burnout leads to a lot of stress. You can have mental health symptoms, you can have physical symptoms, you can have substance abuse, you can have sleep problems. Okay, so all these health issues can come in if you have burnout on the job and you are unhappy in the work. Okay. Now, an interesting topic here is relationship with mental health. So at one point, people used to think that, burnout is just depression. It is depression only. It is depression in the workplace. But it is, yes, it is allied to depression, but it is not depression alone, because it is definitely contextual, related to the workplace. It can be brought about by depression, and it can lead to depression both ways. Okay. And of course, people's personal vulnerability to mental health issues can make them more prone to burnout. So, for instance, there are some types of people who maybe might be very emotional people, very sensitive people. So everything is couched in very emotional terms. Such people obviously will be more sensitive to burnout, because if the situation in the workplace is not healthy, if somebody snaps, if somebody's aggressive, doesn't help, okay, if they put workload on you, they don't give you space to control anything, it's very easy for such people to perhaps sink under it and become get burnt out faster. So there is a close relationship with mental health here. It can lead to depression, and depression can lead to burnout. It works both ways. Okay. Now I'm going to stop here and ask you all to give in your ideas here. I've put 4 examples here, and I want you to talk about what they are. Is this an example of burnout? Just think about it. The first one, would you want to put it into the chat, or would you want to put the answers in the chat, or if you want to just raise your hand and talk about it, that's also okay.
Yeah, both are fine, I think. Yeah.
Okay, I'll read the first one out. A medical resident, who confides to his colleague that he hopes he doesn't get any drug addicts that day in his OPD. What's the point? It's a waste of time. He'll go right back to it after discharge and is wasting his time and hours. From what we shared so far, is this resembling burnout? I'll put these 3 things up again. Exhaustion, a feeling of cynicism and detachment from the job, and a sense of ineffectiveness and lack of accomplishment. Okay? Exhaustion, a feeling of cynicism and detachment, and a sense of ineffectiveness and lack of accomplishment. Now look at that case and tell me, is this burnout? What do you all think? Okay, there's something in the chat. Let's see. Exhaustion. Someone says no, someone else says no.
Yes.
Simple. Yeah. So you've identified it as cynicism, right? So there is a sense of cynicism here, and also there's a sense of not being efficacious, no? There's a sense of lack of accomplishment. He's saying that I can't do anything. He's wasting our time and ours. He's just going to go right back to it after discharge. So he's not hopeful at all. He's not feeling that he can make a difference. He's very cynical that what's the point? It's a waste of time. Okay. So it's quite likely that this resident is going through a sense of burnout. Okay. It's quite possible. Okay. Let's look at the next one. A teacher who tells another, those parents are a real pain. They think their child is such an angel. We know better. Yes, cynicism again, isn't it? The teacher is cynical about the child, okay, and they're also hostile to the parents, right? Those parents are a real pain. Now that's an attitude which no teacher should have about anybody, far less the parents of the children, right? So this attitude itself shows that the teacher is under this kind of burnout situation where they have become cynical, where they're showing these negative attitudes, okay, and they are not feeling that they can bring any change in the child. They are just aggressive about it. Okay, third one, an HR professional who snaps at an employee who asks for work from home. No work from home for me, no work from home for you. Get a medical certificate if you want, but you are not getting work from home, I can tell you. Okay, now, by the way, this was a real case. Okay, so what do you think? There's no cynicism exactly here, but what is this attitude? I'm the boss. Yeah, I'm the boss, and it's quite a negative attitude, isn't it? Lack of control. A human resource personnel is supposed to be they're supposed to be the bridge between the management and the employee, right? They're supposed to see to the needs of both. So here, the HR professional is just is not actually doing their job with enthusiasm, right? They're not seeing to the needs of the employee at all. They are just brushing aside their desire to have work from home for whatever reason, and medical certificate or whatever, and they're just saying, no, 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 this is the policy, no work from home, no point bringing a medical certificate, I'm not going to help you at all, just forget about it. So this negative attitude also is possibly because HR professionals also can have a very difficult job, okay, doing a lot of stuff which is incessant. The personal connect with people can be tiring, okay, and they can burn out. Okay, so any other comments in the chat? Lack of control, yes. No compassion, yes, that's true. Okay, final one. An NGO worker who comes home tired after a fortnight's rescue work in flood-hit Assam, but sits up all night finishing his report. Next day, he has severe chest pain and needs to go to the hospital. So what's going on here? Heavy workload, yes, Angelin. Burnout, yes. So here we can see clearly it's the workload issue plus the stress, and then most probably the rescue work and all would have had a lot of emotional, stress as well as physical. And you can see here the physical stress. He has worked for one fortnight over there, but when he comes home exhausted, he still has to finish his report. And then you see that there is a medical problem which comes in, and chest pain, heart attacks, increase in diabetes, mental health issues. These all can be common in uh, in a stressful work situation causing burnout. All right. So actually, all these four cases, it's possible that there is a burnout issue here. Okay, all the four cases. Okay, going then to briefly to treatment and prevention. So treating and preventing should be at both the individual as well as the work group and the organizational level. All right. So when we talk about the organizational level, I find that most of the time people only talk about what should be done at the personal level. That's always what happens. But it's very important to realize that the organization also has a lot to do with it, and the organization also needs to change, and put in systems which are friendly, so that people would be less prone to burnout. Okay, so making sure that the workload is sufficient, it should be interesting and engaging and stimulating without being too much. So you have to constantly check that the workload is not stressing people out. You have to make sure that there are enough breaks for people. As I said, the hospital, after the initial wave of COVID, realized that the staff needed breaks. So after 4 days or whatever it was, they would have 2 days break compulsively where they had to go home and rest. Okay, so this kind of thing was good for morale. It helped them to go back and relate to their families again, and to be able to just do the work that they couldn't do when they were coming home tired from the hospital. So giving enough breaks and time for other aspects of life is something which organizations need to do if they want to retain their staff at a high level of functioning without burnout. This is better. In the short term, if you push people to work more, it might be beneficial in the short term, but after a little while it will all implode. So it doesn't make any sense to push for excessive work thinking that it'll benefit your organization. Giving more control to your people is very important, and in order to do that you should be constantly getting feedback from them. So there are of course HR procedures like whatever 360-degree feedback and this and that, which will tell you how much control you're giving, whether the boss is supervising too much, whether they are sitting on your head too much, whether you have enough autonomy. All these things will come out. And it's important to get the feedback from people so that you can make changes which are important. Brainstorming is very important. No, it gives people a sense of control. I remember that even when I was a resident in mental health, this was something which was, I thought, quite innovative in Nimans when I was there, that the whole unit would sit one afternoon for a brainstorming session, and the smallest, youngest resident would sit with the chief of the unit, and we would all just sit and talk about what we saw in our patients and how we could have done it better and what we could do to make the ward better or stuff like that. So there was a sense of uh, engagement and control, which even the youngest president like me could feel with the seniors and everybody. You felt that you were valued. You felt that you were able to influence decisions which impacted your work and your place. So this kind of thing is really important. One would think this is a soft thing, but it's really important for increasing the sense of control that people have, which helps them to be able to work better. Checking your reward systems is important. Are you rewarding people enough for good work? Do you give enough praise? Do you give enough recognition? And most organizations do have, no, they have feedback systems. They have stuff which recognizes people's achievements. You should just make sure that it is justly done and it is consistent, so that people get that sense that when I do something good, the reward comes in time. Building community is very important for each organization, all right? Building support groups, having activities together, encouraging partnerships across units. All these things build community. And it's important for the boss to make sure that relationships within his group are going well. So building community is very important. Fairness in the system is very important. And again, for this, you need to get feedback. Sometimes whistleblower policies are important. Fair policies in hiring and promotion, which are absolutely transparent, is very important. Because if it is kind of clear that the boss's nephew is going to get the job, then people will not trust the organization, right? And that sense of fairness is lost. But if you have fair policies, I remember in one organization which my husband works for, there was this policy that when there was a job vacancy, anybody could apply for it. Okay, anybody who felt that they were qualified for that position could actually apply for it. And I was thinking that that is a pretty unique thing. In most organizations don't allow that. If you have this post vacant, imagine the youngest person also being able to apply for that if you think that you can do it. Okay, so this sense of fair policy on hiring and openness and transparency and doing it justly will lead to a lot of work satisfaction and lack of burnout. Making sure that your organization is sticking to its values. And in churches and all this, we need to check this. Are we sticking to the values from which we started? Because if we don't, if we have gone off track, then it's likely that people will burn out and leave because they are not interested in the policies or in the way that we are functioning anymore. Okay, and this has happened in many organizations, many mission organizations as well, if we compromise on our values, or if we become rigid, or if we become very sexist, perhaps, or if we become, if any of our values change, it's possible that people will get, burnt out, because they lose that enthusiasm to work in the place. Okay. How do we treat burnout if it's happening to us personally? If we find that we are exhausted physically and mentally, if we find that we are not, enthusiastic, if we are sort of cynical and detached from our job, and if we feel that we are not performing, if we feel that I'm not able to do this anymore, that sense of doubt about our own capabilities and all that, if that is happening, then we need to make sure that all these things are in place. Make sure that your workload is not too much. Sometimes it may help to correct your idea of work. Why are you working? And I think that among Christian churches, we do talk about work, but more and more this should be a thing among everybody, I think. That work is something good and work is something blessed in itself. The chance to work and create something is a wonderful thing that we all have. But it's not everything. We should not allow it to take over all parts of our life. And it's not what work we do that, or how much money we get for it, that makes a job useful. It is how much of service it is to others that should make a job useful. How much it fits with my gifts and talents, it should make it my correct fit. So all these ideas of work, we need to correct often our ideas of work to make sure that we are working properly. Move to sustainable jobs, okay? That if you're asked to work for 14 hours a day and you're trying to work 2 shifts, well, that's going to be really tiring. I know that sometimes people are forced to do this for monetary, because when they have real deep financial needs and the jobs don't pay well enough. But somehow we have to help each other to find breaks and find, if our watchmen, for instance, are working like that, we need to be able to give them time in the afternoon to sleep if they are actually going and working somewhere else at night as well. So find ways to help people to have breaks. Find coping skills, okay? Learn to manage time better. And again, cognitive changes are important. Are you a very perfectionist person? Are you thinking that your job should be 100% perfect? Or would you be able to be satisfied with 90 or 95, right? So that sort of thing would help you to deal with burnout better, rather than spending hours and hours to make something perfect 100%. Learning how to resolve conflicts with your neighbors, your colleagues, your clients, increasing your social support with colleagues and family. This is very important. All right. General health measures, perhaps just check that you're sleeping well, that your diet is okay. Are you getting enough exercise? Are you getting enough recreation? And last and most important, understand where you are going, what you're thinking, what you're doing, and if necessary, go and get therapy or counseling. And this will help you to deal with your problem of burnout. Okay. So just to repeat, I just repeat that burnout happens in situations where there is a lot of intense personal, emotional kind of contact, or in these other situations that we talked about. And it's the opposite of engagement, right? So instead of high energy and enthusiasm, strong involvement, and a sense of efficacy, instead you end up with an overwhelming sense of exhaustion, a feeling of cynicism and detachment, and a sense of ineffectiveness. And then we talked about these different areas where you have burnout, where there's heavy activity, or very boring work, or where there is no control, over the difficult and effortful work that you do. So we talked about these 3 areas of exhaustion, detachment and cynicism, and lack of effectivity. And we said also that these 6 areas are important to make sure that you are not burnt out. Make sure that the workload or the work hours are sustainable. Give a sense of control to the person. Make sure that there are some rewards. Make sure that there is a community to support. Make sure that there is justice in the community, and the values of the organization are important. Okay, so this is what I wanted to share, and now the time is back to you, Abhijit.
Thank you so much, Dr. Jamila. In a short time, you've put this together. We're very grateful. Dr. Jamila, is it possible to kind of complete the topic in covering burnout among women who are at home working or just looking after the family? And is that also, or does that take the discussion to a different level? Is there some points you could speak about?
No, it's the same thing really, because if you look at it, I'll just put my screen up again. It's really the same thing, because I told you those three things are what?
Yeah.
Exhaustion, a sense of cynicism and detachment, and a sense of ineffectiveness. So again, it's the same thing. Suppose you have a lot of work taking care of elderly parents. I should really have included that as well. Suppose you have very long hours. Maybe they wake you up at night, and the day also you have to do it. So if you're physically tired and you're not able to, get enough rest, and if you start feeling that, oh, what's the point of this? Anyway, I don't get recognized for it. So if there's no recognition or justice in the system, where you're taken for granted that you have to do it, and there's no relief, there's nobody to help you, there's nobody to step in, there's no support from your family or colleagues, and if you feel that, okay, what's the point, I'm not even doing anything, it's not even working. So all these three things can set in and lead to a sense of burnout. So the same thing, you're going through the motions of it, but it's not with that energy and enthusiasm and idealism. You're doing it because you have to do it, you've lost the joy of it. So in a sense, that is also burnout only.
Correct. Yeah. So, because in our society, often women are expected sometimes either to completely manage the home, or if sometimes even to work and then manage the home and everything.
Yes,
And so there's a high degree of burnout among women.
yes, that is completely true.
Yeah, yeah,
That is completely true.
right. Thank you very much. I think with this,